Vice President of Government Operations and Specialty Programs for college hospitals. Cerritos is an acute freestanding psychiatric hospital. We do programs and units for adults, older adults, adolescents, and then the two DDMI populations for adult and adolescent. Our adult DDMI program is 18 beds, and our adolescent DDMI program is 12 beds. College Hospital Cerritos is situated here in the southeastern part of LA County, and for the most part functions as kind of the psychiatric ER for Los Angeles County, serving about 2 million people in this particular region. The DDMI program initially started back in 2005 as a specialty behavioral health treatment program for clients with both a psychiatric diagnosis as well as a developmental disability. So they're clients that are dually diagnosed. A program that can manage dual diagnosed clients that have pretty much failed in a lot of different treatment modalities in the community, have been bouncing around and losing their out-of-home placement behaviors, whether related to either the psychiatric diagnosis or the developmental disability, have become severe. Self-abusive behavior, assaultive behavior, combative behavior, property damage, running away from placements, that type of thing, non-compliance with medication, a whole myriad of things. We are special in the sense that we have tools here that no other program that we're aware of here in California offers, and that is that because we're in a freestanding psychiatric hospital, it's a locked setting. We have clients on the DDMI program that are both voluntary and those that are involuntary. We can do all the appropriate psychiatric evaluations and come up with proper diagnoses as well as the appropriate medication regimen that may be required for a client. We can handle the more severe behaviors because we can utilize on an emergency basis medication, seclusion and restraint, and it's available to us when needed. And on the behavior side, what makes us really special is that we do have we have a very strong behavior modification program and intensive case management team approach to our daily milieu and treatment of the clients. We have core staff on the unit, that is, we have specially trained nurses, mental health workers, dedicated social workers, activity therapists, psychiatrists that just work with this population. That type of consistency is real important in being able to implement successfully behavior plans and behavior modification interventions. We have a very rich staffing ratio so that we have a heightened level of supervision with the clients 24 hours a day, so that we can avoid having to use, so we can keep the population safe. And by doing that, we're able to reduce the use of PRN medications, seclusion, restraint, and those types of things that really, for a client who's been here in the program successfully, by mid to the end of their stay, we're really not using any of those things anymore. The client is being managed primarily by their behavior plan and the staff's intervention of utilization of that behavior plan. Trainings are mandated by our contract and by regional center, and so when they audit us to make sure that we're providing these types of trainings and ongoing training for all core DDMI staff. We just do a lot of specialty behavioral health, drug and alcohol programs all over Southern California. The DDMI programs, adult and adolescent, are two of those that we do. Dr. Mouton and myself created the program, and it's the only program of its kind in the state of California. In fact, in the western United States, but definitely in the state of California. And way of viewing a client, because we have them so long, our job, the DDMI unit, is to stabilize the psychiatric condition and begin to work on the behaviors that need to be, the severe behaviors that probably got them here. This population, to get in this unit, referred by the regional center, they just don't send anybody. You have to be a client who has been constantly in and out of psychiatric hospitals. You may have been in and out of jail, juvenile hall if you're an adolescent because of your acting out behaviors. You're constantly losing your out-of-home placement, or your behaviors are so severe you can't stay at home. And it gets to a point where they're running out of places for these people to go because they've never been appropriately evaluated or treated. Every time you go to a new psych hospital, you may get a whole new diagnosis, depending on the psychiatrist. Every time you go to a new psych hospital, you may end up on different medication than you were from the time before. And there comes a point when we don't know if this population is acting out because their psychiatric disorder is not stabilized, their medication's all screwed up.
Hi, my name is Maricel Fortesque. I am College Hospital's DDMI Nurse Manager, Program Director. The way we have our patient clientele here at DDMI is they're developmentally disabled, mentally ill, regional center clients. What the kind of service that we provide here is a little bit different than all the other psych hospitals in a sense that we operate behavioral, through the behavioral problems. We have a behavior analyst that works with our clients. We develop independent, specific treatment plans for each patient. So it's not just like psych and PRN all the time. It's more like behavioral modification and training. We use teleconferencing, video conferencing room. We have this video setup where, since our clientele comes from far distances in Northern California, what we do on each end is we have a video conference, and we can see each other through the camera, and we just discuss openly any issues about the client, and the doctor will be present, I will be present, Larry, the behavior analyst, Keith, and the whole team will be present, open forum and specific.
Hi, my name is Larry Humphries, and I'm the behavior analyst at College Hospital, Cerritos, DDMI unit. What we try to do here from the behavioral perspective is to enhance the quality of life of our clients. And the way that we do that is by creating a behavior plan that is conducive just for our clients. We get our goals from their coordinator, and from there we create a plan that actually allows them to work on their targeted behaviors, which can be aggression, motor disruption, or vocal disruption, which seems to be the three core targeted behaviors that we focus on. But we also work with maladaptive behaviors. Here is considered the day room, where a lot of activities go on with our clients. And the activities can be anger management, and also the main activity is school. This closet right here is actually what's considered our behavioral store, where clients will, at the end of the day, will trade in their behavioral dollars that they earn for being appropriate with their targeted behaviors and attending groups, and be able to go into our store. What day it is, what month, the weather outside, and if there's any special events for that particular month. Like, the rationale for the TV being behind that protective glass is for safety purposes. So if anyone might have a out of control episode, they won't go to the TV, throw it, break it.
I'm Keith Hall. I coordinate social services on the DDMI unit here at College Hospital DDMI unit, and very excited about being a part of this program. This population, we have clients who are developmentally disabled, as well as they have a primary diagnosis. They really need a lot of support, and we're very excited about having the opportunity to collaborate with regional centers here in California, as well as work with family members to educate them on some of the challenges that they face with their loved ones, as well as working with other service providers in the community. We work with group homes.
Oh, we've had many good experiences with DCFF clients. When you get them to come in, and many of these patients, we try to treat the whole person.